Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Wajohat. Today we will discuss another topic that is diabetic ketoacidosis. That is a patient who is having diabetes mellitus, suffering from diabetes mellitus. Sometimes this sugar or the diabetes is not controlled. And if it is not controlled for a longer level and the glucose level remains high, then it can lead to the production of ketone bodies. And the ketone bodies, they are acidic in nature, and that they will alter the pH of the blood and the body, and hence it will become very dangerous to the person. So all those, even the ordinary people, they should check up their blood sugar levels after a few intervals, so that he or she may be suffering from diabetes. And especially those persons who have got a family history, they can have diabetes. More chances are there. So the diabetes mellitus is of two types: type 1 and type 2. Type 1 means there is a pancreas has the beta cells are not producing insulin at all. So that patient is wholly and solely dependent upon the insulin. And the other is the diabetes, type 2 diabetes. There is a patient was not having diabetes initially or previously, but now due to some reason, the beta cells, they are exhausted and they cannot produce much insulin that needed for the control of the glucose. So a patient will have the type 2 diabetes. That is, normally the insulin controls the glucose level in the blood, and when their level is high, more insulin is produced, and it uh, enters the glucose into the cells, so that in the blood glucose level may become normal or low. And this is a mechanism in the normal person. But in the diabetic patient, especially, the insulin is not produced in sufficient amount. Either it is not produced at all, that is zero production, or it is produced less than the needed by the body. So then, because of this, the insulin, the glucose level will become high in the blood. That is known as hyperglycemia. It will lead to this polydipsia, polyuria, and polyphagia. So these are the critical signs, symptoms of the patient who is having diabetes. So when glucose level remains high for a longer level, the diabetes is not controlled. It leads to the production of the this bodies, that is ketone bodies, by the liver. And these ketone bodies, they are acidic in nature, so they lower the pH of the body and the blood in the blood. And this pH, it disturbs the function of the body cells. So this produces lead to the different complications, and if not treated, it may lead to death even. So it produces two or three complication. One is dehydration. Other is the production of ketone bodies, and thirdly, this ketoacidosis. And we have to tell the people who are suffering from diabetes that they must be careful about this to prevention of this complication, because prevention is better than cure. Every diabetic patient should consult his physician time and again, so that the level may not go higher, and she or he should have the uh, equipment with them to check this insulin levels. And there is again one more investigation, that is HbA1c, that shows the previous 3 months control. So that by doing these investigations, we may come to know that the patient is having better control of the diabetes or not. So accordingly, the patient will be managed, and initially the management is diet control and life modification. That is, you have to lose the weight and exercise by exercise and taking less intake, and this it is not controlled by the diet alone, then one should have to use this oral hypoglycemic agents, which may control usually they control the diabetes blood glucose level. But after many years, sometimes it may happen that these tablets, they cannot control the diabetes, because these tablets, the hypoglycemic agents, they only this support or enhance the production of the insulin from the beta cell. But if the beta cells are very much weak and they don't have any much potential to produce insulin, they cannot be stimulated by these agents, and the insulin is not produced, or it is produced less than needed. So then the person has to take the insulin injection, that is regular insulin and long acting, and mix after mixing these two categories, and along with exercise and lifestyle modifications. So gradually the investigations are done, and this it is established whether it is type 1 diabetes or type 2, and it is, if there is family history, one must be more conscious about the product this the diabetes mellitus. The person may have he should be prevent try to prevent this complication, other diabetes mellitus, by uh, taking normal the needed balanced exercise and diet and exercise, and better sugar control by taking oral hypoglycemic and even the insulin. So this is for the normal the public awareness, that you should get check up your blood sugar level, and you may be suffering from insulin this diabetes mellitus, and who, especially those who have got the family history. And if one has diabetes mellitus, then he should consult as a physician, the diabetologist, and take the advice and the measures to take for prevention and the treatment for the diabetes. So, if one is aware and one is conscious about his blood sugar levels, he there are less chances that he go to the will go to the diabetic ketoacidosis. So only those patients who are hidden and unknown, but they suddenly become this hypoglycemic, they are established, they are diagnosed, are those who have diabetic but they don't take medicine, and for the longer level they produce they may have the diabetic ketoacidosis, which is very serious condition. So when we manage this diabetic ketoacidosis, because there is severe dehydration, and we will give him the normal saline 0.9%, and 1 liter in 1 hour, and 1 liter in next 2 hours, and 1 liter next 3 hours, gradually. And plus the insulin, which is more usually the regular, this by titration in the normal saline burette, and by also a long acting, and usually the subcutaneously. So this is for the normal people, for their awareness, that is, they should not take it this casually, but should take it seriously. And with this, thank you very much. Khuda Hafiz.